Gastric emphysema. Introduction. Referring to the presence of gas in the wall of the stomach is a relatively rare imaging. Finding the stomach is the less common location for intramural gas in the gastrointestinal tract.
Edel from surgery, Karen Horton and Bill Scott, and myself. And what is gastric emphysema? Well, it's air in the wall of the stomach. It's been called many things, from gastric emphysema to pneumatosis to emphysematous gastritis, depending on the etiology and the associated clinical findings. It's the least common location of gas in the GI tract. We've all seen pneumatosis coli for many reasons, including ischemia. We see small bowel air. And in an article of 86 patients with GI pneumatosis on CT, only 9% had gastric pneumatosis. And in fact, quite honestly, I think it's even lower than that. In different series, the mortality for gastric pneumatosis was high, up to 38%. And of course, the highest mortality is when multiple organs were involved, colon, small bowel, and stomach. But of course, those are cases with massive infarction typically. Now, in terms of literature, there's very little written. There's case reports about gastric emphysematous gastritis or emphysematous gastritis. The infectious variety is the most dangerous condition. It's uncommon. A review of the literature identified 27 cases over nearly a 100-year period. Because of its poor prognosis, it's very difficult to distinguish benign gastric processes that have air from gastric emphysema, at least on the thought process level. And so our question was, can we be able to determine which is benign gastric emphysema and which is emphysematous gastritis, which is more of a surgical emergency? And again, the importance, of course, is we have seen gastric emphysema in patients as incidental findings, but how much do you make of it? Okay, so that indeed becomes very, very important, and we'll take a look at that. So maybe the way we'll do it is by looking at cases. Well, we'll look at this case, classic emphysema of this gastric wall. You can see the outline between the soft tissues around the stomach and the contrast in the stomach. This was a 68-year-old male, post-liver transplant, had nausea and vomiting. There's no wall thickening. There's also gas seen in this patient in the superior mesenteric vein and portal vein. And once you see those findings, of course, there you have to say, okay, this is ischemia, this is a surgical emergency, and in fact, this patient had the total gastrectomy, and what we found was emphysematous gastritis with ischemic features. And unfortunately, this patient did eventually die, but it's important to recognize now we
Oftentimes, when you're pulled over by a police officer, you become very nervous. This may cause you to have stomach problems or gastric reflux or acid reflux as a result. Perhaps it's a condition you already suffer from in your own medication. Unfortunately, if you have acid reflux or you're burping or belching because of the nervousness of your stomach, this may cause the breath test to be much higher than your actual blood alcohol level. We can talk about this as one of the defenses to a DUI.
Gastric causes. Emphysematous gastritis, infections, ischemia causes ingestion, increased intraluminal pressure, such as during endoscopy, severe vomiting, or in the setting of bowel obstruction, perforated gastric ulcer. Traumatic causes: endoscopic biopsy, endoscopic organ plasma coagulation, to placement blood trauma. Idiopathic. Extragastric causes: small or large bowel ischemia, gangrenous cholecystitis, cessation of pulmonary gas, such as from rupture of a pulmonary bulge. Conclusion: the implemented measures of endoscopic mucotomy plus convergent broad spectrum antibiotics turned out in a positive impact regarding the gastrointestinal aspect, unlike the rest of the progression of heart-based rheumatologic disease.